The Chuseok holiday period is coming up in South Korea, during which millions of Koreans travel across the country to spend time with family. Well, health officials here are optimistic that almost 70% of the population will soon have received their first dose of a coronavirus vaccine. There are still concerns that transmissions will continue to rage on with the Delta variant spreading rapidly, not to mention with the news of the new Mu variant that's been spreading across the globe. We discussed the new challenges posed to restriction measures today, and for this we have Alice Tan, internist at MizMedi Women's Hospital, and Paul Griffin, Associate Professor of Medicine and Infectious Disease Specialist at the University of Queensland. Thank you both so much for joining us this morning. And well, to start with you, Dr. Tan, now level 4 measures here in South Korea, they've been extended till October, and well, restrictions on private gatherings, though, they've been eased to 6 people in metropolitan areas and 8 people in non-metropolitan areas, including those who have been vaccinated. But with the Chuseok holiday coming up later this month and millions of people expected to travel around the nation to be with family at that time, many are wondering whether these restrictions will truly keep infection numbers down. I mean, does it make sense at the moment to have different levels of restrictions in each city or province? And also, is it time to start loosening restrictions as the government has done?
Well, I think the answer to your latter question is it's a little bit too early to ease restrictions right now. The full vaccination rate in the country is a little less than 40% of the entire population. And if we look at other countries and regions around the world that have similar full vaccination rates, we can see that transmission levels are very, very high once restrictions are lifted at such a low full vaccination rate. So I do think it is a little bit too early. In terms of a regional approach to mitigation measures, I think that does make sense. And that's only if you have decided that you're not going to take an elimination policy approach, such as New Zealand and China have done. I think Korea may have had that option to do an elimination strategy back in April of 2020, but right now, of course, that's quite impossible. And so the best that we can do is risk assess each region in terms of their hospital capacity, their transmission dynamics, the compliance of the population, regional behaviors, and try to tailor mitigation strategies to each region. Now, here in the United States, the state of Hawaii has taken sort of a dramatic approach in asking all travelers not to visit Hawaii. On their website, it says the governor has stated it is not a good time to visit Hawaii, which is very unusual for them, but it's because they are going through their worst surge right now. They had COVID under pretty good control throughout the pandemic, but right now they are going through their worst surge, and so they have taken an approach where everyone needs to quarantine for 10 days unless they have provided proof of vaccination or proof of a negative PCR test, much like many countries have done.
And Dr. Griffin, now, well, until recently, 70% was the herd immunity goal for most countries around the world. But with the spread of the Delta variant, it seems that this goalpost needs a bit of an update. What do you think the new goal should be?
Look, I think the simple answer there is as high as possible. I mean, clearly 70% of people fully vaccinated is a really good thing and will definitely have an impact on transmission. But I don't think that's enough, and I don't think we should stop there. 80 is certainly better, but I think we should even aim higher than that. Obviously, it gets challenging the higher the rate goes to keep increasing that. But the simple fact here is the higher we get our vaccination rate, the less we'll have to rely on other strategies to control transmission. And also that'll go a very long way to reducing, for example, the emergence of new variants. So the simple answer here, as I say, is to get that rate as high as possible.
And Dr. Tan, while the government's asked people not to travel back to their hometowns if they can avoid it, but restrictions, they've been further loosened for the week of Chuseok so that 8 people can gather indoors and 6 people in cafes and restaurants. And also travel restrictions, there aren't many, it seems. It's been limited to trains, which will just run at a 50% capacity by the window. But the government still remains positive. It says that if vaccinations continue at this pace and if the current level of protection measures are maintained, then it predicts that the number of daily cases are going to peak to around 2,000 to 2,300 between now and the 20th of September, and then it will start to decrease. Would you agree with this forecast, or do you think there are some risks to that plan?
I don't agree with that forecast, and the reason why is because we know that the number of cases of unknown epidemiological link over the last 2 weeks is nearly 9,000. And so this means that there are perhaps thousands of cases who are infectious in the community who have just simply not been detected. And so it really is a matter of increasing contact tracing and increasing testing to try to find all of those cases that are spreading the infection, perhaps unknown to even themselves. And so I think that that kind of prediction is a little bit unrealistically optimistic. I think that what is more realistic is that the numbers of daily new cases will increase after the Chuseok holiday. However, one piece of good news, I think, in terms of a recent trend in Korea is that the number of cases in ICUs has decreased significantly by about 10% since the beginning of September. And hospital capacity, in terms of ICU bed capacity and staff, that remains at a reasonable level right now. And I think that's what's encouraging the government to allow people to gather a little bit more freely this Chuseok than in previous holidays.
Now, Dr. Griffin, South Korea and Australia, they began, in the early days of the pandemic, they began with good social distancing policies that helped them kind of lower the numbers, flatten the curve, but they've been rather slow in terms of vaccinating the population. So how should these kind of countries really adapt their mitigation strategies at this point?
Look, I think it's really challenging because while we've been very fortunate to have excellent control, I think then people get a bit of an underappreciation for what the risk is, and their risk perception of this virus and this pandemic is not sufficient to get them to have enough urgency to be vaccinated. And that's certainly a thing we're grappling with very much in our country at the moment, with very low rates of vaccination. And I think it needs a multi-pronged approach to try and address that. I think we need to get the messaging right to make sure that people have a good understanding of the risks versus benefits of these vaccines, and to know just how important vaccination is and how well it works in controlling this virus. And then, of course, make sure people have realistic expectations for what opening up will look like, and that we're unlikely to have a true freedom day where we have enough people vaccinated that we forget about our other strategies, but that we can continue them in parallel, but in a much more balanced way. So have a very reasonable suite of additional mitigation strategies to apply with a high vaccination rate, so that we can go about our lives as uninterrupted as possible. And I think people need to start to recognise that, and also to recognise the benefits of people being vaccinated and the fact they are protected, and starting to allow them some freedoms, perhaps before people who aren't yet vaccinated.
And Dr. Griffin, the Mu variant of COVID-19, it was first detected in Colombia, of course, in January, but now it's been listed as one of the 5 variants of interest by the WHO. So what do we know so far about its transmissibility, and also is it able to actually withstand the current COVID-19 vaccines?
I think it's important to point out the difference between a variant of interest and a variant of concern. So a variant of interest has some changes in the genetic structure, some mutations that give it the potential to have some properties that are of concern. If we prove those properties are indeed the case, such as the ability to evade vaccines, then it will be upgraded to a variant of concern, but it isn't yet. Certainly some changes in the structure indicate it might have the potential to have reduced protection from the current range of vaccines. But I don't think this one will evade them properly just yet. But of course, we need to do some more testing, and there's a lot of good work underway to see just what the level of protection with this variant are. And if we do show that it evades vaccination, then it will be upgraded to a variant of concern. But we have to remember, we probably will see a variant that can evade vaccines to a high degree at some point in time. but all the leading vaccine manufacturers are already prepared for that eventuality. They have the capability to make a vaccine to a new variant fairly quickly, so it won't necessarily be the doomsday situation some people have been saying it might be.
And Dr. Tan, well, all this news about new variants, it has been very unnerving news for most of the population here in South Korea. And currently there's an interval of 6 weeks between the first and second doses of receiving an mRNA vaccine. And the government said that it would consider readjusting the term. Do you think this is likely, and should this interval be reduced as soon as possible?
Well, I think the South Korean government took this approach in order to give a wider, a broader, protection with first doses because of a supply shortage of mRNA vaccines. There is some observational data that show that one dose of an mRNA vaccine can give fairly high levels of protection for up to 10 weeks. But we do know that administering a booster will increase antibody levels. And so I think once the supply issue is taken care of, and I think it has been with the new shipments that have come in of recently, and that we have full vaccination of the most vulnerable populations, such as the elderly, immunocompromised, and people in long-term care facilities, then I think shortening that interval to closer to, say, 28 days or 3 weeks, that's recommended for the Pfizer vaccine, I think shortening that interval will probably make sense.
And Dr. Tan, well, other countries around the world, for instance, the United States, the UK, they're starting conversations about vaccinating school children. But of course, in South Korea here, most of the adult population aged between 18 and 49, they started getting vaccinated late last month. So rather late to the game. But so we still have this level 4 distancing. But the Education Ministry, they've decided to allow schools to expand in-person classes so that first and second grade elementary students, as well as senior high school students, can actually attend in-person classes every day. Considering that children in other countries are starting to get vaccinated already, do you think this raises concerns for children here in the country?
Right, it's a very difficult balancing act. I think the interruption to our children's education has been one of the greatest tragedies of the pandemic. And the American Academy of Pediatrics, they recently stated that they fully support opening of schools for in-person learning, but with caveats, with warnings in place and with guidance in place. They ask that every adult in the household of a child who's going to school get vaccinated. And of course, all of the adults at school, teachers, staff members, ancillary staff members, they should all be vaccinated as well. And then of course, universal masking should be pursued. I think in Korea, universal masking has been followed by students, by children very well, and by the whole population very well. That's not an issue. I think what we should do is concentrate on vaccinating the family members of school children and also all of the teachers and adults at the schools. And if those measures are in place, then I think we will be able to keep our children in school safely.
Now, Dr. Griffin, with new variants constantly evolving and emerging in communities around the world, there's concern that vaccine efficacy is declining over time. Is there a way for us to stop new variants from spreading?
I think the simple answer there is to control the number of cases that are around. We know these variants arise through mutations when the virus is reproducing, and that has to happen in susceptible hosts. So the more people that are vulnerable, the more transmission we see, the more cases we see, the more likely we are to see new variants emerge. And that's why we need to focus so much on prevention, both through the widespread use of vaccination, and not only in our own countries, but in across the board, across the world. And then we also need to combine some simple mitigation strategies to help limit transmission as well. And so those simple things that we're becoming so much more accustomed to, masks, hand hygiene, social distancing, high rates of testing and isolating positive cases, those sorts of things to reduce transmission will go a very long way to helping reduce the prospect of new variants emerging.
Well, due to time, I'm afraid this is where we'll have to end the interview today. That was Dr. Alice Tan, internist at MizMedi Women's Hospital, and Dr. Paul Griffin, Associate Professor of Medicine and Infectious Diseases, Specialist at the University of Queensland. Thank you both so much for your time today.
Thank you.
Thank you for having me.
And to our viewers, as always, thank you very much for watching.